Hello, I'm Ruth Hansten, and welcome to our discussion of Section 7, Organizing Your Work, in your portfolio for Relationship and Results-Oriented Healthcare Professional Practice Specialist Program. So what we're going to do now is really look at the care delivery model or system or structure that you're using in your own particular area. Now, depending on, if you're home health, if you're working in ambulatory care, please contact us if it doesn't seem like some of this is fitting for you, and we'll give you some other tools that you can use. But when we think about organizing your work, there will be some excellent resources and support for you in Clinical Delegation Skills, Chapter 6 through 7. If you're with us on your first page of Section 7, Organizing Your Work, we want you to also lead, if you haven't read all but the last chapter of the Rock Planning and Implementation Manual, you should be through chapters 1 through 4, and also complete worksheet 11 and 12. And we'd like you to review the 10 steps of the ROC processes that we talked about back in section 2 of this workbook, and obviously it's discussed quite a bit in your ROC Planning and Implementation Manual. So your care delivery model is discussed in worksheet 11. So when we think about how RNs work with assistive personnel or other support personnel, we wanted you to think about, reading up on what results people have gotten from working with assistive personnel and what kind of care delivery plans or models you've used in the past that work, what didn't work, and then really listening to a shift report or a handover. So if you are working in, say, home health, usually people in home health tell us they have their Monday team conferences. So that would be a kind of handoff that you might get, or you might get a call from the hospital sending a patient into the home health system. Rate that kind of handover and whether or not it was working effectively. We also ask you to look at how people are assigned and how else you might assign them given the kinds of folks that you have available. We also ask you to do some other tasks and processes. For example, when you do your introductory rounds, do you think that the patients that you're seeing are similar to those that you heard about in report, if you're not doing report at the bedside already, which most people are? That's in our practice anyway. Worksheet 12 is assignment evaluation. We'd like you to actually talk to your colleagues a little bit about, hey, how would you rate your assignment today? How would you change it? How do you expect to get out on time? How would you recommend a different way of assigning the work or the patients that we're working with? And how good is the teamwork? So that you really have an idea of how the organization of care is working in your department. So remembering here, we have now gone through some evaluation of ourselves in our own practice, a lot of evaluation of ourselves in our care delivery areas. We've compared it to the Professional Practice Acts. We've looked at what the ROC processes are. And so the next section we'll be looking at then, after looking at how we organize our work, we'll be looking at teaming and communication next, which is section 8. So we have only 2 sections left. Thank you for joining us today.